Hospitals across the country are adapting to meet the new challenges that come with treating patients during a pandemic. NBC's Joe Fryer got a look inside a Seattle hospital's COVID-19 ward.
We've seen the dramatic images of people near Seattle rush to the hospital, but it's rare to see what happens next inside a place that's treating patients.
We're in the hot zone, and we've got about 20 patients on this ward.
Dr. Seth Cohen and his team use their own camera to exclusively show us potentially life-saving steps taken inside the COVID-19 ward at the UW Medical Center Northwest campus. Here, they've created hot zones for coronavirus patients where personal protective equipment is required, and cold zones where it's not.
This is the cold zone, and what we've done is really cocooned the nursing station in some protective plastic with windows so that we can still see what's going on the floor.
Before going into the hot zone, they suit up, and when leaving, they take off all their equipment, all under the watchful eye of an observer who makes sure they're doing it correctly. They call this person a dofficer. It's a play off the word doffing, which means taking off equipment.
What does that extra set of eyes mean?
You can be sure that you're doing it correctly, you're doing the steps in order. A lot of times in healthcare, we're doing things that are very rushed, and unfortunately, it makes it easy to contaminate ourselves.
The hot zones also help them conserve valuable protective gear like masks and gowns because they don't have to take them off between patients. UW has also converted some floors of the hospital to negative pressure to prevent spreading infection.
If there are any aerosols that are generated, those aerosols do not come back out into patient areas or staff areas. They all leave the building.
That negative airflow means doors must stay closed, so nurses are using baby monitors to help keep an eye on patients.
How big of a difference do you think these changes have made?
I think it's made a huge difference. And even just from the standpoint of staff morale, we do think it makes for a safer work environment, and that's really been our top priority.
No doubt these have been difficult weeks with some patients dying, but they've also cared for people who've gotten off their ventilators and survived.
And I just can't tell you how much the staff, and all the providers celebrate when that happens. We're actually thinking about starting to play music overhead anytime one of those events happens, just so everybody is aware.
Janitors and housekeepers are doing dangerous work trying to help contain the spread of COVID-19, and many of them are doing it without essential protective gear. NBC News business and technology correspondent Jolene Kent has more.
Inside hospitals on the front lines of the coronavirus, alongside the doctors, nurses, and healthcare workers, are an army of cleaning staff, janitors, and housekeepers working around the clock to keep hospitals clean, entering vacated isolation rooms to scrub and clean the room for the next critical patient. But for all they risk on the job, they lack enough protective equipment. The SEIU, which represents 225,000 janitors across the country, say that workers aren't being properly informed about the dangers they face in this pandemic. Here are two brave voices from the inside. First, Marcus Buell, a housekeeper specialist at Northwestern Memorial Hospital in Chicago.
Well, right now, to be perfectly honest about it, it's kind of scary for the mere fact that in the last 3 weeks or so, we've really been through a lot. The housekeepers have not been supplied the proper PPE, and we are one of the groups that are on the front line. Yeah. Because we clean and we sanitize and we make sure that the hospital unit, as well as the entire hospital, is sanitary for the conditions that we have to deal with. But we have to do that without the proper PPE, mask, glove, gown, goggles even. People are scared to do what they really want to do for the hospital. First and foremost, everything and everybody on that unit, regardless of what they do, that contributes to the well-being of the health regarding the patient, none of that can happen unless the housekeeper does their job.
Northwestern Medicine responded, and their spokesperson said the health and safety of our employees, physicians, and patients is our highest priority. Since the outbreak of COVID-19, we've gone to extraordinary lengths to maintain an environment that protects everyone. We continue to follow the recommendations of the CDC for personal protection equipment and have been fortunate to date to secure sufficient personal protective equipment to do so. We update our guidance daily for caring for COVID-19 patients as it continues to evolve. We provide multiple channels for communication, including a dedicated hotline so that our staff can ask questions and receive support. We also spoke with Jose Abalos, a housekeeper at Kaiser Permanente Sunnyside Medical Center in Oregon.
I've been with Kaiser for 12 years.
Wow, 12 years. Have you seen anything like this in your 12 years of service?
First time.
How much do you worry about the shortage the hospital is telling you about?
I have faith that we are going to get more soon. We get it the sooner the better. How much I'm worried? We need the PPE, the proper PPE right away. We don't want to run out and then have to reuse something that is not safe.
When you enter an isolation room and you're wearing all of that gear and you're cleaning, it seems really scary. Are you ever worried that you're putting your life at risk?
No, I just don't think about it. And like what I said, the key is do what I had to do. Do the proper way. Using the proper PPE, and we're going to be safe.
Well, I just wanted to say thanks. Is there anything else you wanted to add to tell me about your experience?
I do. I just want to mention that this is real. This is not a joke. And we have to take it seriously. We have to take steps to get where we need to be in order to be safe. And I urge our governments to please provide us with the proper equipment to deal with this situation.
Coronavirus cases are still on the rise here in the U.S., but in China, where the virus originated, we are seeing some signs of hope. NBC News chief foreign correspondent Richard Engel has the latest.
Hello, everyone. I hope people are well. Today's big international COVID-19 headline goes right back to where this outbreak began, back to Wuhan, China, which is opening up. Hubei province around Wuhan had already seen some of the lockdowns lifted. Now Wuhan itself, the city of 11 million people, quarantines are over. People are out on the streets. Public transport is up and running. The buses, the trains. People are going out to food carts and buying noodles. And China has been criticized for perhaps fudging some of the numbers, not being as open as it could have been, especially in the early days. But what is undeniable is that before, people were at home in lockdown, and now they are back on the streets. China is still nervous. They're still concerned that there could be cases of reinfection, that this virus could come back. So people are being told to monitor their health, to take their temperatures, and to use a kind of a tracking app when they get on public transport. So still a great deal of surveillance is happening there. Here in the UK, the Prime Minister, Boris Johnson, remains in an ICU. British officials, however, say he is stable, conscious, that he is not ventilated, breathing on his own. So no major development in his health status. And let's hope if there is a major development, it is because he is getting better. All right. I hope people are well. Thanks a lot.